hearing and the ear. Each part of the ear has a special function for your hearing. Let's start with the pinna, or the auricle. The word auricle means ear. When you learn about the parts of the heart, you'll find that there are flappy structures on the outside of each atrium called auricles. So actually color all the way through here. This is the outer ear. And the purpose of the auricle is to funnel sound waves into the ear. Before hearing aids, the only way that elderly people could increase the amount of sound waves that they were able to process is they would actually have a large funnel that they would stick in their ear when they were trying to have a conversation. So hearing aids have gotten quite a bit smaller since those days. I'm sure everyone's happy about that. Okay, now we'll go a little bit inside of the ear. This is the external auditory canal. External auditory. Sometimes it's called acoustic, and that's fine. Either one is okay. And the sound waves then move through the external auditory canal. And there are also hairs and wax to catch and move debris out of the ear. If the wax does build up, then you can put like mineral oil, or and then if you go to the pediatrician with a kid that has a bunch of earwax jammed in there by their eardrum, then that can affect hearing. And so then they might soften the earwax and then pull it out with a vacuum. Seems like children, because they have a smaller external auditory canal, have more problems with this. And then another thing to mention about something that can happen here is something called a swimmer's ear. This is actually a fungal infection in the external ear, and it can be quite painful. You can see why it was called swimmer's ear originally, right? Because it's from a chronic moistness in the ear. Okay, next up is the tympanic membrane. If you are into orchestra, you know that the timpani section is where the drums are. And sure enough, your ear has a drum in it. Tympanic membrane is taut connective tissue. Taut is kind of like tight. Stretched tightly. And this is converting energy from one form to another. Converts the sound waves into mechanical movement. Now, if anything happens to that tympanic membrane, then hearing will be compromised because that's the conversion point of the sound waves into mechanical movement. A very, very loud sound can actually vibrate the tympanic membrane so severely and so violently that it perforates, gets a hole in it. Another probably more common reason that someone can damage their tympanic membrane is if they have an ear infection and pressure in this area here called the middle ear, and pressure builds up and presses out on the tympanic membrane, it can actually get a rupture in it there too, from that cause too. And we'll come back to middle ear infections in just a minute. Okay, so then that mechanical movement is translated to the inner ear bones. The 3 inner ear bones, we'll use orange, green, and blue for these. The first one is called the hammer, or Latin is malleus. So it first goes to the hammer. And then that is converted it's stuck to the next one, the anvil, or the incus. So it's like a hammer hits an anvil. And then when that wiggles, it causes the next one to wiggle, the stapes. My 7-year-old loves that he already knows that these are the very tiniest bones in your whole body. And you only have 206 bones in your body, and so 6 of them are these middle ear bones, because you have 2 ears, right? And then the stirrup is the name given to the last one, or Latin is stapes. So anything that would happen that could break down these bones here could also compromise hearing. And again, chronic ear infections could erode away the bone there, which is kind of scary to think about. Most ear infections resolve without those kind of complications, but it can be a complication with chronic ear infections. Okay, so before we go on, I do want to mention the eustachian tube, another structure that joins up with the middle ear. Eustachian tube. It connects the middle ears with the back of the throat. And it has a great function, but oh my, we also see some things that go a little sideways here. So its purpose is to equalize pressure between the space in the middle ear and outside the body. So if you fly up in an airplane, then the atmospheric pressure is going which way, up or down? So when you go up in an airplane, atmospheric pressure goes down. So if you go up, atmosphere pressure goes down. And what that means is that the pressure inside of your middle ear is going to be greater than outside of your body. So by opening your mouth and yawning, you can let air escape out the eustachian tube. The phenomenon changes when you go back down again. As you go down, then the atmospheric pressure goes up, and so now you need to add air into the middle ears. And that can cause pain either on going up or down in an airplane. And it's especially tricky for little kids because their eustachian tubes are very narrow, and sometimes they have a funny kink in them that makes it harder for them to equalize pressure. But this might help you understand why either yawning or for a baby, for them to be nursing, allows easier access between this. So we could actually put that on here. So yawning, chewing gum, or nursing in the case of a baby. Help open the tube for efficient pressure equalization. Now, what about if you go down? If you are a diver, let's say, and you go down. Now, as you go down in the water, the atmospheric pressure around you is getting higher and higher and higher and pressing in on your tympanic membrane. And although when you go down, then what's happening is that you're equalizing the pressure. It's when you go back up again that if you go too quickly, then you could burst your eardrum. So diving also can take a pretty serious toll on the middle ear. And then otitis media, or middle ear, so middle ear inflammation. So you see three words in here. Ota means ear, media means middle, and itis means inflammation, or middle ear infections is what we talk about, is when viruses or bacteria or inflammatory response, maybe allergies, may block the eustachian tube from equalizing pressure, or it might just build up too much pressure in the middle ear and be pressing out. And then if it's building up pressure and blocking the eustachian tube, you have a situation set up for a painful ear infection. And the pain is because of pressure. The pressure on the tympanic membrane especially. And now imagine if you take a child that has a cold up in an airplane and they're unable to do efficient equalizing of pressure. Okay, so now let's come kind of full circle and talk about what might be done for someone that has chronic ear infections. They used to do this a lot more than they do now, but they used to put tubes in the ears. If someone has tubes in the ears, what they mean is they put a little tube right through the tympanic membrane. So if this is the tympanic membrane, they put just a little tube right there, and that will equalize the pressure or allow drainage of pus. But what they found is that the tubes don't stay in very long. Usually after a couple of weeks they come out on their own. That's not always the case, but sometimes they stay longer. And that the tubes themselves may contribute to scarring on the tympanic membrane. So if the tympanic membrane bursts, then it may be able to heal itself, but it might have a scar. The same thing goes for the tubes. The tubes in the ears may help release the pressure for a while, but they might contribute to long-term scarring, which can cause hearing damage down the road. So perforated tympanic membranes may heal with scarring, may contribute to long-term hearing loss.